I see a lot of patients who've had nasal airway surgery in the past, and they don't think that their airway is improved as much as it can be. As I say, I see a lot of patients like this, and the commonest reason for me seeing a patient after they've already had airway surgery once is not what you think. And the main reason for seeing these people is, honestly, they probably didn't need the nasal airway surgery in the first place. And so they've had an operation done, they don't feel there's been an improvement, and the commonest reason for that is their airway wasn't that bad in the first place, and the previous surgeon who operated on them probably should have said, this is all you're gonna get, cowboy. And the airway can't be improved a great deal, and unfortunately we can't give you the airway that you might want to have, and so they come in to see me because I've been doing this a long time, and I'm going to say that probably 70% of these patients cannot be improved and should not be improved. Why? Because we can't give them a bigger airway. However, occasionally we can improve the airway, and sometimes it amounts to making the nose wider and bigger. And you tell me how many patients want to have a wider and bigger nose? Not that many. And so if you as a patient feel that your airway isn't as good as it should be, talk to your family doctor, get a referral into the Orofacial Surgery Center, and we'll assess you endoscopically, look in your airway, and see whether or not we can help you. Sometimes we can, sometimes we can't, but we will give you a very honest appraisal of your airway. If you've done your research and you're thinking of having a surgical procedure, call our staff at the Orofacial Surgery Center and they'll book you in for a consultation, and we can weigh your options for potential surgery.